Thank you for joining us for another Spotlight on Scholarship here at OCU. Today we have two guests with us from the Physician's Assistant Program, Rebekah Carlozzi. She's Principal Faculty and Primary Investigator. And this is Jose Medina, Director of Program Evaluation and Assessment and Co-Investigator. Welcome.
Thank you.
Thank you.
Thanks for having us.
So we have a couple questions for you just to tell us a little bit about your scholarship here at OCU. Tell us a little bit about the PA program at OCU and its goals for our students.
Well, the PA program, I think one thing that sets our program apart is that we have some different elements that not every PA program has in the state or in the country. And some of those have to do with our emphasis on holistic training. Having our humanities program is a huge component of our curriculum. And we incorporate literature readings throughout the course of our didactic training. We also incorporate plays. We had a live play recently by the theater department on campus to perform Wit, which was a fantastic way to incorporate that aspect with our medical program. We also have a huge emphasis on service. So we take our students to Good Shepherd Clinic twice a month, so that they can go to a clinic that serves the uninsured and learn about medical training within that context.
We really focus on the human inside, training them to be a better human or humanitarian within the scope of medicine, and I think that's very unique in this region.
Brene Brown's had some excellent work. One of the things she talked about was that empathy is a tool of compassion and that it's a skill set of basically showing that we understand something that someone else is going through and that we're able to communicate or perspective take about what they're going through. And so it kind of has two components. There's affective empathy, which is more of our emotional response, like for example being sad when someone else is sad or happy when they're happy. And then there's a component called cognitive empathy, which is more that perspective taking, where we're able to kind of use our imagination and imagine what that might be like without actually having gone through something exactly the same as what that person is going through. It hasn't, from our perspective, been well taught consistently, but that's one thing that we feel like empathy has a huge component to patient-centered care, because that is an emphasis, but it's not something that we actually are taught how to do well.
Medical professionalism, really, one of its core components is empathy, and we don't do any training of that. We just let people model it. And if you can start enhancing those traits while you're learning how to be a medical professional, it's only going to make you a better holistic provider in the end. Mm-hmm. This is a business of people. You didn't get in this to talk to a robot, So we have to connect people to people, and if there's not trust and rapport, then we're not going to have good outcomes.
Mm-hmm. We want students to have the skills, the ones that aren't naturally maybe as likely to lean in or connect with patients, to learn to do that better. And then those that may have an overemphasis on their affective empathy, to learn to kind of make that more cognitive and be able to make that connection with another person without then carrying the burden of their cancer. I remember when someone, I think it was during my training, that someone posed a question to me, would you rather have someone that's competent or caring as your provider? And of course, it's like, well, no, I don't want to die, so I want someone competent that knows what they're doing. But why do we have to choose? Right. Why does it have to be an either or? Like, is it either competent or caring? Why can't we shoot for competent and caring?
Yeah, both.
And I think at our PA program, that's what we're hoping to do. We don't want to take away from anything we're doing on the cognitive side or the competency side. Like, that is still of utmost importance, because we do need someone that's competent as our healthcare provider, but we also want them to be healthy people so that they can be caring people when they're done.
Thank you very much for your time.
Thank you.
Rebekah and Jose, for your time
put.
today. And Wonder Twins. And hopefully next month we'll come together for another Spotlight on Scholarship. Thank you much for your time.
Thank you.
Thank you.